We're learning more about the condition that took the life of legendary singer Jimmy Buffett. He died of Merkel cell carcinoma. Not a lot of people were talking about that before, and now a lot are. So joining us to talk about this, Dr. Jeff Pothof, UW Health Chief Quality Officer. Doctor, great to see you. This is a rare and aggressive form of cancer, and it's skin cancer, right?
Yeah, absolutely. And it's something that a lot of people have probably never heard about just because it's not all that common. Here in the United States, we see about 0.5 to zero point 0.7 cases per 100,000 people. So it's not that common, but unfortunately, it is a pretty aggressive form of cancer. A few things that put people more at risk, certainly older age. Being fair-skinned certainly seems to be a significant risk factor. People who are immunocompromised tend to be more likely to get this disease than others. Yeah, something to be aware about. At the same time, something that most people aren't going to have to worry about.
Sun exposure, does that play a factor? Oftentimes we talk about that when we're talking skin cancer.
Yeah, with Merkel cell, there certainly seems to be, cumulative risk of UV radiation, which is sun exposure, is a risk factor for Merkel cell, just like it is for melanoma, other skin cancers. Really can't overemphasize. Thinking back when I was a kid, boy, we didn't use sunscreen very often. Nowadays, really important to make sure you're using sunscreen or clothing to try to limit your exposure to UV radiation.
And maybe this goes not just for Merkel cell, but maybe we're really shining a light on all skin cancers here. I mean, are there things we can do at home? Is there a way we can check and see if there's something that maybe we need to go see a doctor about?
It is a good idea to do skin checks, monthly, every other month, however you want to do it. But just pay attention, particularly to moles or nevi, things that you've had for a while. Are they changing in shape or configuration? Are they becoming more nodular? These are things that we can do to kind of identify this. And then if you see something you're suspicious about, bring it up to your primary care physician. See if it's something that needs a little bit more investigation. But just being aware that these things exist and checking yourself is a good first step.
Yeah, unlike other cancers, skin cancer is on the outside. So what would it look like where it shouldn't look right, or we know that might be something we need to get checked out?
Typically you're looking at changes in the skin, anywhere from like a mole or nevi, a brown spot that now has irregular edges or it's starting to grow. Those are more, common with the melanomas, to even kind of something that seems like a scale or a scab that just isn't going away. Maybe it's on your nose, on your face. Those can be early signs of other skin cancers. Merkel's, like Jimmy Buffett had, typically is a nodule, kind of feels like it's almost under the skin that can be firm, sometimes pink or even almost a purplish coloration. But those are things to look for if you're wondering, could this be something that I need to have looked at more?
Good information there. We got a minute to talk about this, but I want to ask you about this interesting piece in the New York Times. Talking about long COVID and seniors, experts have found seniors really facing some special challenges with this.
Yeah, we keep on hearing more and more about long COVID, and as much as we're hearing about it, there's still a lot that we don't understand. This study looks at seniors who are less likely to be diagnosed with long COVID, and that could be from a number of factors. It could be that they're truly just getting it less often. Maybe they're more likely to be highly vaccinated. We know that that's true. They're more likely to wear masks in places and decrease their COVID exposure. It might also be that we're underdiagnosing them. Long COVID being mistaken for something else, or patients thinking that this is just something that they have. But it is proving very challenging for older individuals as far as its impact on ability to do, daily life things like go to work and do the things that they enjoy. As much as we know about long COVID, there's still so much more to know as far as like who this affects, what systems it affects, and more importantly, what should we do about it so that we can treat it.
Yeah, years into this, the research continues. A lot of unanswered questions out there. Dr. Jeff Pothof, thank you for your time. We appreciate it.
Thank you.